transverse lateral accessory glide for the hip now. So we're going to use one of these seat belts because it's much easier in terms of application of the technique. So we can use our body weight to apply the technique. So we wrap the belt around and through onto the inside of the thigh. Typically you want the buckle to your side. Doesn't matter which side as long as it's to a side, because it's easy for you to adjust, and also you won't dig into your back or anything. We need the belt relatively high up towards the inner thigh, just so we can get as close as we can to the head of the femur, so we can apply our technique as close to the joint line as possible. We then need to stabilise at the knee and also stabilise on the lateral pelvis, so you're kind of around ASIS and round to the iliac crest. And then from there you fix and fix, and the movement then comes from your pelvis. So the belt should be going roughly across your buttocks. If it's going across your lower back, it's too high. It needs to be across your buttocks. So essentially what you can do is almost do like a squat technique. So you apply your force that way by pushing your backside backwards, essentially. So you push backwards in there to apply this lateral glide. And of course what you can do with these glides, these lateral glides, whenever you've got a distraction type technique, you can either hold the distraction, and with this belt it's very possible for you to do that, or you can then oscillate. So you could obviously do your grading system, so you could do a grade 1, do a grade 2, grade 3 into resistance, and grade 4 at the end of range. Longitudinal core dad. A couple of ways we can do this. We can do this with the belt, which I'll demonstrate first of all. So again, belt around you, adjusted to the correct length. Put the buckle on one side so you can adjust it during. And again, you need the belt nice and high up, right into the crease of the hip joint. And I'm going to raise this up into flexion slightly. And again, the belt needs to go around your glute area so that you can apply your pressure backwards from your pelvis. I've also got the patient running from corner to corner of the bed so that I can then go in line with them rather than having a slightly transverse effect. Okay, so we take it into flexion, we're stabilising at the knee, and then we're going to apply our pressure coming slightly down. Just orientate, make sure that belt is going slightly down and away, and then we apply our pressure down here. So we can do our longitudinal, and then we can grade it. Just a nice light grade 1, slightly larger grade 2, grade 3, grade 4. Of course, with any of these distraction type techniques, you could also just hold. The other option is to do it without the belt. So for this, we need to just place a towel across. And then what you need to do, obviously very clear in terms of your informed consent, and your hands therefore need to go as close to the hip joint as they can, so you're having a pulling effect on the head of the femur. When you apply your technique, try to do it almost as a scoop. So you're trying to push down as you initiate your force, and then you pull downwards. You push down towards them and then pull away and distracting down. So we can come up into here. If you need to as well, you can always put a pillow or a towel into your shoulder. I'm quite bony, so it can be that it's a little bit uncomfortable for people on their knee. Hands gripped together, interlaced, right into the joint, and then we need to pull down, so towards their pelvis, and then distract downwards. Okay, so we can test range. If we do a grade 1, so it's down, grade 1 initially. Grade 2, much larger, emphasize coming off. Grade 3 now, much more force. You should see my fingers are going quite white as I'm pulling. There's quite a lot of force involved. Then grade 4, again, feeling for the end of range, small oscillations. Hip joint AP and PA. So we start off with PA, which you would do from posterior. So we need to roll up and ensure that we can get to the greater trochanter. Okay, so this is quite a nice position as well for finding the greater trochanter. Once we've found that, then again you're going to go from behind in here with your the palm of your hand, so you can push it anteriorly. But whatever the position the femur is in, you have to work at 90 degrees to it. So if it was furthermore extended, then you would obviously come round and push more that way. As it is, it's there, so I need to run 90 degrees in line with it here. So this hand is going to be affecting the mobilization. This hand is going to stabilize the proximal bone, which is therefore the pelvis. So we're going to hold onto the pelvis here, getting nice in behind with my stance, so I can affect my pressure using my feet, not just using my arms. Okay, so then we apply the pressure here. Okay, to my end of range. And then grade 1. Grade 2. 1 and 2 has pretty much come from your arm. Grade 3 into resistance now, so now I start to use much more of my legs, my body to apply the force, as well as doing a counter movement with my, in this instance, my right hand on the pelvis there to counter the effects of my anterior glide, and then my grade 4 towards the end of range. For AP, we're going to come around the other side. Same thing, stabilising the pelvis here, running anteriorly now on the greater trochanter. Quite a good idea as well if you try and use your fingers to almost grab the other side, so you're getting the greater trochanter like that. So then as you push it, you're almost holding onto it on the posterior side also. So just in there, just helps a little bit with stability. Okay, so then we're going to apply our pressure posteriorly, checking the range. Grade 1, grade 2, emphasise coming off, grade 3,